Let's pick up on that conversation around the vaccine rollout. Today, we have a special emphasis on vaccines in South Africa and, in this case, how the rollout will manifest in business. Now, Business for South Africa says that the South African economy, particularly the recovery, is likely to be guided by how the COVID-19 vaccine rollout takes place. Now, the Minister of Health has confirmed that the vaccine rollout strategy will incorporate the public and private sector. South Africa is targeting to vaccinate 40 million South Africans in an effort to curb the spread of COVID-19. Joining us now to talk to us further about these plans and the expectation of the rollout plan as far as the vaccines are concerned is Stavros Nicolaou, head of the Health Working Group for Business for South Africa. He talks to us from Johannesburg. Mr. Nicolaou, thank you very much for your time. Firstly, do you have a firm date for when these vaccines are actually going to land in South Africa?
Firstly, thanks very much to you, and good morning to all the viewers. So the understanding is, of course, that we've secured as a country via the National Health Department 1.5 million doses that will vaccinate 750,000 healthcare workers, because it's 2 doses per healthcare worker. The country has secured those from the Serum Institute, as you indicated earlier. The further understanding is that these vaccines will arrive in South Africa towards the end of the week, so towards the end of this week.
All right.
Sorry, go ahead.
So from the end of this week, I just want to be precise, towards the end of this week, that first consignment of 1.5 million is going to land somewhere at our ports of entry.
Okay, so our understanding is that there are 1 million in the first consignment, 1 million doses. Mm-hmm. And then the remaining 500,000 will land sometime in February.
All right. And then talk to us about your involvement as business. Which element of these vaccines getting to South Africa and being rolled out, where are you most involved as business?
Okay, thanks. Thanks for that question. It's a really pivotal question for the country. Firstly, business doesn't see the rollout of the vaccine as being the singular function of government. It certainly has to be a government-led process, but all sectors and social partners, South Africa, that make up the social fabric of our country need to be involved in the rollout. Business is obviously a key constituency in supporting and where necessary, complementing government. And that is exactly the role we will be playing. We will be playing a coordinating role, one of mobilizing resources where necessary, particularly resources at a logistics, supply chain, at the point of administering the vaccine to patients. Yeah. So all the big provider groups, whether it's the general practitioners, the pharmacy chains, the independent pharmacies, even dentists. So everybody that will be administering the vaccine, we are coordinating and aligning those resources so that we can best support and complement government.
All right.
Of course, we're also working closely with government to look at how we can support the financing piece. There is at present there isn't a clear roadmap as to how the country will fund all of this. Yeah. I think the different pieces are falling into place, but business is certainly playing an integral role as well in trying to solve the financing part of this.
So that's the element that I want to tease out, Mr. Nicolaou, very briefly if you can. Your understanding of where the financing is going to come from, because what we know thus far is that government is the main purchaser, but where will the money come from? What have you been told?
So all we know at this point in time is government have indicated that they will fund the bulk of the vaccine purchases. So in my assessment, it looks something like this. The country has secured 12 million doses for 6 million lives from COVAX, and government has put down a down payment through the Solidarity Fund for that. So I think that segment, those 6 million lives are covered. You will then have the medical schemes covering around 7 to 7.5 million lives. And then the balance of it is what government is looking to fund. And I understand there will be announcements shortly, including in the finance minister's budget speech, as to how that will be achieved, both in the short and in the longer term. And then lastly, business is currently engaging with its own constituencies to see to what extent, in the principle, in the same spirit of solidarity that we've approached the pandemic as business, how can we, through the solidarity principles we've employed previously, also look to fund or make a contribution towards this?
Yeah. Our own plans to basically manufacture our own vaccines, are you aware of any efforts around that?
So, look, the vaccine manufacturing involves different phases, and some of those phases we can do in this country, and there are already 2 manufacturers that can do what is called the formulating, filling, packaging, and labeling. The 2 are Aspen, and I think Aspen has already announced a manufacturing partnership with Johnson & Johnson, where it will contract manufacture the Johnson & Johnson vaccine. And then, of course, BioVac, which is the other South African company, also has the capability to do formulating, filling, packaging, and labeling. What we don't have capability to do as yet in the country is to produce the active substance that goes into the vaccine. Some people call it the antigen. And the active substance is what actually triggers the immune response once it's injected into the body. Sure. So we have formulating capabilities, but not capabilities to backwardly integrate into active substance as yet.
All right. Final question, Mr. Nicolaou. There has been a lot of bickering in the country around the safety of these vaccines. Some people totally opposed to taking this vaccine. How assured are we that the first batch from the Serum Institute is absolutely 100% safe to be administered into human beings? And I ask this on the back of reports suggesting that there had been a blast at this Serum Institute in India.
Okay, so I'm going to give you 3 very quick responses. The first thing is that the safety and efficacy of vaccines is proven through various clinical trials, and many viewers would have heard about the preclinical phase 1, phase 2, and phase 3 data that's required. Once that data is available, it gets independently reviewed by in South Africa, it's called SAHPRA. That's our medicine regulator in South Africa. These are all independent experts that review the data, and only if they're happy with the data will they register the product. Okay. Sometimes you bring in an unregistered product from abroad, but you are still required to review the data that's available that proves the safety and efficacy. So something that is either approved or registered by SAHPRA is the first step in giving patients or viewers out there that first level of assurance. The second thing that we've got assurance around is that there have been no shortcuts in these clinical trials. Yeah. So the same clinical trial protocols that have been adopted with other vaccines have also been adopted here. So that should give a further level of assurance and comfort. Yeah. And then lastly, the critical question is, when you import any medicine into South Africa, you are required to do quality assurance on the product to ensure that that product was manufactured under the required standards and meets all the quality aspects that are required to deliver a safe and effective vaccine. So this quality assurance will happen on receipt of the product in South Africa. And of course, if it doesn't meet the quality standards. It will be rejected and not available for vaccination. So those are the different levels of assurance that the public can take. This is a highly regulated process. It's done independently, and it's done by experts who know this field very well. And my very last comment is, we have been using vaccines for many decades in our country, many decades. Yeah. Millions of South Africans have taken vaccines over many decades. And in fact, they are the most effective way of preventing disease. That and clean running water are the two most effective ways. So there's no different process that's going to be applied this time around to what we've been applying for many decades in the past, from which many millions of South Africans have benefit and no doubt will continue to do so.
Stavros Nicolaou, thank you very much for your time and clarity on some of these contentious issues. He's head of the Health Working Group at Business for South Africa. They're going to be playing a very pivotal part around the vaccinations or the vaccines reaching the country once they're here, distribution.